Jamaris Malone, a native of Washington, D.C., is an actress and model who was born with sickle cell anemia. She has accomplished a lot in her young life, but not without struggle. I spoke with her earlier about living with the blood disorder.
I was born with sickle cell anemia, so I was raised always knowing. My parents explained it to me when I was a very young girl that I had the disease. My mom explained to me why I couldn't go outside with my brothers and play in the snow, and why I couldn't go jump in the swimming pool, and why I had limitations that other children didn't.
And you learned to accept it.
I did, and I feel like that's what made me become an artist.
Guess what? I'm going to Kisangani next month. What?
Because I had to be in the house. I had to make pretend. I had to depend on my imagination to be my playmate, to give me entertainment.
Now that you're older, you're still a young woman, but I mean, now that you've grown, what are some of the symptoms that are recurring?
I experience pain crises on a daily basis. I do have a severe case of sickle cell anemia. I'm hospitalized about 8 to 10 times a year. And so I do, even more so than when I was younger, experience more crises and have to deal with managing that pain on a daily basis. And the older I get, you know, the higher my pain tolerance is, the better I get at dealing with the pain and knowing how to treat myself, knowing when I need to go to the emergency room or when I can just go to urgent care and get a couple of bags of fluid or maybe a blood transfusion.
How do you manage the pain?
I have to take, of course, pain medication. My pain tolerance is, I would think, higher than a lot of other people, and so I'm used to having to do daily things, producing the show, running all over the place, with being in crises at times, because I don't want the pain to limit me from being able to enjoy my life and do what I believe I was put here on this earth to do, and that is to entertain and make change.
When you are in pain, where does it hurt?
It depends on the crises that I'm having. Most of the time it's in my lower back, but it can vary from being in my lower back to my ankles to my chest, to I have chronic headaches and migraines. That's something that happens on a daily basis. My wrist, a lot of the joint areas, and then sometimes you'll have internal pain where it's like in the organs, your stomach, you know, those type of areas may hurt. You have acute chest syndrome, which is something that sickle cell patients suffer from, and they also die from sometimes.
Are there any triggers to the pain?
Yes, stress is a trigger. The temperature is a trigger. Extreme temperature changes, getting dehydrated. So if I overexert myself dancing or, you know, running or doing any type of physical activity, if I don't pace myself, I'll go into a crisis.
With all your activities, I mean, actress, model, and, you know, other activities that you may have, how are you able to control the pain? How do you deal with all that?
I know with what I want to do and what my daily activities are like, how long I can stay up before I go into a crisis, how many hours I can go, you know, on end, on fast pace without having to take a break before I'm going to get hospitalized. I know these things now from me testing my boundaries, trial and error, basically.
Do you worry at all about children?
I do want to have children, and I know that with me being a sickle cell patient, I am a high risk, you know, for having children. But there are many people with sickle cell that have had children. Women who have sickle cell, they can get pregnant. They do have children. They do have healthy babies. It's just that, you know, you have to educate yourself. You have to know exactly what you're getting into. You can't just pop up and decide, oh, I'm going to have a baby. You know, it has to be a planned thing, and you have to take care of yourself.
As a patient, do you have any wishes, any hopes?
Right now, there is only one FDA-approved drug for sickle cell, and there are several FDA-approved drugs for different causes, different diseases that are out there. And I feel like a lot of research has been done for sickle cell. A lot of progress has been made. We have the stem cell transplant that people are getting, and that's being successful. The bone marrow transplant that people are getting done, that's being successful. And so since we are, the sickle cell community and the researchers are coming to this breaking point where some change is happening, if we just keep pushing the boundaries, if things like the Colors of Sickle Cell fashion show are done and different charities and organizations, people keep talking about it, if we just push a little bit further, we may get to the point where a cure, can be very possible very soon. I will wish for that to happen, so that not just here in America, because even in places like Nigeria, there are people with sickle cell who aren't living past 5 years old. And that's unfortunate. And I feel like if we push a little bit harder, then people will have a little bit longer, they can see a future that's, brighter than 5 years.
What an inspiration she is. Jamaris Malone is passionate about using the arts to create change, and she's organizing the benefit fashion show, Colors of Sickle Cell, to support the Sickle Cell Disease Association of America. Vincent.
Lenore, thank you very much for those updates. And viewer, please watch Lenore Mudu's health reports every Tuesday and Thursday right here on In Focus.